I want to talk to you today about something that a great many older adults notice, often as one of the first signs that their knees are changing: pain going down the stairs. You manage going up reasonably well, but coming down, that's when your knees protest. An ache, a sharpness, a sense of grinding or instability in the knee with each downward step. So you find yourself gripping the handrail, taking the stairs one at a time, leading with a particular leg, or dreading the descent altogether. And it's tempting to just accept this as your knees wearing out, an inevitable part of getting older. But here's the truth I want to share with you today. Knee pain going downstairs usually has an understandable cause, most often the common wear and tear arthritis, and, crucially, there's a great deal you can do to ease it, protect your knees, and keep them working, especially through strengthening the muscles that support and protect the knee. So today I want to explain why going downstairs is so hard on the knees, what causes the pain, why it matters, and most importantly, how to protect and strengthen your knees and ease the pain. And I'll keep this calm and practical, because while knee pain deserves attention, much of it is manageable, and protecting your knees is very much within your power. Let me start with why going downstairs is so specifically hard on your knees, because understanding it is genuinely illuminating and explains the whole thing. Your knees bear a great deal of load with everyday movement, and stairs amplify this dramatically. Going downstairs is particularly demanding because, with each downward step, your knee has to control your body weight as you lower yourself, working to absorb the impact and control the descent against gravity. And this places very high forces through the knee joint, considerably more than walking on the flat, and in a way that especially loads the kneecap and the front of the knee. So coming downstairs subjects your knees to some of the highest loads of ordinary daily life, which is exactly why, when the knees are affected by wear or other problems, going downstairs is so often the first and most painful thing, the activity that reveals the trouble. Going upstairs is demanding too, but in a way that's often better tolerated, while coming down, with its high controlling forces on the kneecap and joint, is typically where the pain bites. Understanding that descending stairs is uniquely hard on the knees explains why this is such a common and early complaint, and points to why strengthening the supporting muscles, which help absorb and control those forces, helps so much. Let me walk through the causes because while there are a few, one is by far the most common. The leading cause of knee pain going downstairs in older adults is osteoarthritis, the wear and tear arthritis, where the cushioning cartilage in the knee joint wears down over the years, so the joint has less cushioning, becomes stiff and achy, and hurts more under high loads like descending stairs, often with a sense of grinding, stiffness, especially after rest, and pain that's worse with demanding activities. The knee is one of the most commonly affected joints by osteoarthritis, given how much load it bears, and pain going downstairs is one of its classic early signs. So osteoarthritis is the most common cause. A related common cause is problems with the kneecap and the front of the knee, where the kneecap doesn't track smoothly, or the cartilage behind it is worn or irritated, which causes pain specifically with stair descending, squatting, and kneeling, since those load the kneecap, and this is very common. Other causes include problems with the menisci, the cushioning pads in the knee, which can be worn or torn and cause pain and sometimes catching or locking, inflammation of the tendons or other soft tissues around the knee, inflammatory arthritis, less commonly, which causes swelling and prolonged stiffness as I've discussed, and previous injuries that have affected the knee. So knee pain going downstairs is most often osteoarthritis or kneecap-related problems, with meniscus issues, soft tissue problems, and others as further causes. And the good news is that the mainstay of managing most of these, especially the common wear and tear kinds, is the same: strengthening and protecting the knee, which I'll come to. Now let me explain why this matters, because knee pain going downstairs is more than a nuisance. It has real consequences for your independence and beyond. First, it directly threatens your mobility and independence. Stairs are part of so many homes and so much of daily life, So painful, difficult stairs can genuinely limit where you can go and what you can do, and can make your own home hard to navigate. Second, and importantly, there's a safety dimension. Knee pain, weakness, and a sense of instability or the knee giving way on stairs are a genuine fall risk. And falls on stairs are especially dangerous. So painful, unreliable knees on stairs are a real safety concern. Third, knee pain often leads people to do less, to avoid stairs, walking, and activity. And as I've discussed, that inactivity weakens the muscles, including exactly the muscles that support and protect the knee, which worsens the knee problem and the pain in a vicious cycle, while also harming overall health and the rest of the body. Fourth, the pain itself wears on quality of life and can be dispiriting. So knee pain going downstairs matters because it threatens mobility and independence, poses a fall risk on the dangerous stairs, can drive an inactivity cycle that worsens both the knees and overall health, and undermines quality of life, all of which make protecting and strengthening your knees, rather than just accepting the pain and doing less, genuinely worthwhile. So let me get to the heart of it. How to protect and strengthen your knees and ease the pain, because there's a great deal that genuinely helps. And the single most important thing is strengthening the muscles that support the knee. The muscles around your knee, especially the thigh muscles at the front, the quadriceps, act as shock absorbers and stabilizers for the knee, helping absorb and control the high forces of activities like descending stairs and taking load off the joint. So strengthening these muscles genuinely protects the knee, reduces the pain, and improves its function and stability. This is one of the most effective, evidence-based things you can do for knee pain, and it works at any age, as I've discussed about strengthening generally. Helpful exercises, done gently and within comfort, include straightening and lifting the leg to work the thigh muscles, gentle sit-to-stand exercises from a chair, which strengthen the legs, gentle squats holding onto a support within a comfortable range, pressing the back of the knee down, and other knee-strengthening exercises, ideally guided by a physical therapist who can tailor them to you and your knees. Building up the strength of these supporting muscles, gradually and consistently, is the cornerstone of protecting your knees and easing stair pain. So strengthening the muscles around your knee, especially the thigh muscles, is your most powerful tool, genuinely protecting the knee and reducing the pain. And it's well worth doing with a physical therapist's guidance. Let me give you the rest of the ways to protect your knees and ease the pain, because alongside strengthening, much helps. Keep moving and stay active within comfort, because, as I've discussed, gentle activity is good for the joints and the muscles, while inactivity worsens both. So keep walking and moving, choosing low-impact activities that are gentle on the knees, like walking, swimming, or cycling, which keep the knees mobile and the muscles strong without high impact. Maintain a healthy weight, because excess weight places extra load on the knees with every step, and especially on stairs. So losing excess weight genuinely reduces knee pain and load, one of the most effective things for knee osteoarthritis. Use good technique and aids on stairs. Take stairs carefully, use the handrail. Lead with your stronger leg going up and your weaker or more painful leg carefully going down. Take them one at a time if needed, and consider whether a stick or other aid helps. Use helpful supports. Some people find a knee support or proper supportive footwear helpful, and your doctor or therapist can advise. Apply warmth or cold for comfort, and use appropriate pain relief with your doctor's or pharmacist's guidance. And keep your knees moving gently to ease stiffness, especially after rest. So strengthening the supporting muscles, staying active with low-impact exercise, maintaining a healthy weight, using good stair technique and aids, supports and footwear, and pain relief measures all work together to protect your knees and ease the pain. Let me emphasize a couple of these because they're so important. On weight, because the knees bear so much load and stairs multiply it, excess body weight is one of the biggest stresses on the knees, so even modest weight loss can meaningfully reduce knee pain and slow the wear, making it one of the most worthwhile things for anyone overweight with knee pain. On the physical therapist, A physical therapist is genuinely invaluable for knee pain, able to assess your knees, design a safe, effective, tailored strengthening and exercise program, teach you good technique and the use of aids, and guide you in protecting your knees, so a referral is well worth asking your doctor about, especially if your knee pain is significant or limiting. And on the activity balance, the aim is to stay active and strengthen the knees with the right, low-impact, knee-friendly activities and exercises, not to either push through high-impact activities that aggravate the knees or, at the other extreme, to become inactive and let the muscles waste, but to find that middle path of regular, gentle, strengthening activity that protects the knees, which a therapist can help you strike. So weight management, a physical therapist's guidance, and the right balance of knee-friendly activity are especially valuable parts of protecting your knees. Let me be clear about when to see your doctor, because while much knee pain is manageable wear and tear, some warrants attention. See your doctor about knee pain that's significant, persistent, or worsening, that's limiting your activities and independence, or that isn't improving with the self-care measures, both to confirm the cause and to get help, including a referral to a physical therapist and advice on managing it. See your doctor more promptly if your knee is significantly swollen, hot, or red, which could indicate inflammation or other problems. If your knee locks, catches, or gives way, which could indicate a meniscus or other mechanical problem. If you've had an injury, if the pain is severe, or if you have prolonged morning stiffness and swelling suggesting inflammatory arthritis, as I've discussed. And seek prompt care if a knee becomes suddenly very painful, swollen, hot, and red, especially with feeling unwell or fever, which could indicate infection or other urgent problems. So significant, persistent, worsening, or limiting knee pain warrants seeing your doctor to find the cause and get help, while swelling, heat, locking, giving way, injury, or signs of inflammation or infection warrant prompter attention. The doctor can confirm the cause, often osteoarthritis or a kneecap problem, guide treatment, refer you to a physical therapist, and consider other options for more significant problems. The reassuring message is that most knee pain has a manageable cause and responds well to strengthening, weight management, and the other measures. So getting it checked usually leads to genuine help. Let me paint you a picture of how this commonly plays out, because the contrast is the lesson. Picture a woman in her 60s whose knees have started hurting going downstairs, an ache and grinding with each downward step, so she's begun avoiding stairs, walking less, and doing less generally, assuming her knees are just wearing out. But her growing inactivity is weakening her thigh muscles, exactly the muscles that support and protect her knees. So her knees get less support, hurt more, and feel less stable, in a worsening cycle, and her overall health and strength decline too. Then she learns what you're learning today and changes course. She sees her doctor, who diagnoses knee osteoarthritis, and refers her to a physical therapist, who designs a knee strengthening program focused on her thigh muscles, teaches her good stair technique, and guides her in staying active with low-impact exercise. She does her strengthening exercises consistently, keeps walking and swimming, loses some excess weight, and uses the handrail and good technique on stairs. Over weeks and months, her thigh muscles strengthen, her knees gain support and stability, the stair pain eases considerably, and she regains her confidence on stairs and her activity, all while her overall health improves. What she'd been accepting as inevitable wearing out was substantially helped by strengthening and protecting her knees rather than retreating from activity. That's exactly the empowering truth. Knee pain going downstairs is largely manageable, and the way forward is to strengthen and protect your knees, not to give up and do less. And let me speak directly to those of you caring for or close to an older person, because knee pain on stairs threatens independence and safety, and there's much that helps. You might notice a loved one struggling and in pain going downstairs, gripping the handrail, taking stairs one at a time, avoiding stairs, or doing less because of their knees. You can help by understanding that knee pain on stairs usually has a manageable cause, most often wear and tear arthritis, and that the way forward is to protect and strengthen the knees, not to retreat into inactivity that worsens them. Encourage a doctor's visit for significant, persistent, or limiting knee pain, and a referral to a physical therapist, who is invaluable for a tailored strengthening program and good technique. Support the key measures. Knee strengthening exercises, especially for the thigh muscles, perhaps doing them together. Staying active with low-impact, knee-friendly exercise. Weight management if relevant, which significantly reduces knee load. Good stair technique and use of the handrail. And pain relief measures. Importantly, be alert to the safety dimension, since painful, unstable knees on stairs are a real fall risk. So ensure good handrails, lighting, and care on stairs, and address home safety, and know the signs needing prompter attention: significant swelling, heat, locking, giving way, injury, or signs of inflammation or infection. Helping a loved one protect and strengthen their knees, stay active, and use good stair technique can ease their pain, protect their mobility and independence, and reduce their fall risk on the dangerous stairs. Let me draw this all together. Knee pain going downstairs is common in older adults because descending stairs places some of the highest loads of daily life on the knees, especially the kneecap and front of the knee, so it's often the first and most painful sign when the knees are affected. The leading cause is osteoarthritis, the wear and tear arthritis, along with kneecap-related problems, with meniscus issues, soft tissue problems, and others as further causes. It matters because it threatens mobility and independence, poses a real fall risk on the dangerous stairs, can drive an inactivity cycle that worsens both the knees and overall health, and undermines quality of life. But there's a great deal you can do to protect and strengthen your knees and ease the pain. Above all, strengthen the muscles that support the knee, especially the thigh muscles, which genuinely protects the joint and reduces pain and works at any age. Stay active with low-impact, knee-friendly exercise. Maintain a healthy weight, which greatly reduces knee load. Use good stair technique and the handrail. And use supports and pain relief measures. A physical therapist is invaluable for a tailored program. Significant, persistent, worsening, or limiting knee pain warrants seeing your doctor, while swelling, heat, locking, giving way, injury, or signs of inflammation or infection warrant prompter attention. So here's what I'll leave you with. First, understand that knee pain going downstairs is common because descending stairs loads the knees so heavily, and that it usually has a manageable cause, most often the wear and tear arthritis, not simply irreversible wearing out to be accepted. Second, embrace the most powerful remedy. Strengthen the muscles that support your knee, especially the thigh muscles at the front, which act as shock absorbers and stabilizers, genuinely protecting the joint and reducing the pain, ideally with a physical therapist's tailored guidance, and know that this works at any age. Third, support your knees further by staying active with low-impact, knee-friendly exercise like walking, swimming, or cycling, rather than retreating into the inactivity that worsens them, and by maintaining a healthy weight, since excess weight greatly increases knee load, especially on stairs. Fourth, use good stair technique and aids, taking stairs carefully with the handrail, leading appropriately, one at a time if needed, and using supports, footwear, warmth or cold, and appropriate pain relief, and be mindful of the fall risk on stairs, ensuring good handrails and lighting. And fifth, see your doctor about significant, persistent, worsening, or limiting knee pain for diagnosis, help, and a physical therapy referral, and seek prompter attention for significant swelling, heat, locking, giving way, injury, or signs of inflammation or infection. Knee pain going downstairs is largely manageable, and the way forward is to strengthen and protect your knees and stay active, not to give up and do less, which only worsens things. So take care of yourself, strengthen and protect your knees, stay active, manage your weight, and use good technique on stairs. And because diagnosing the cause of knee pain and providing a safe, tailored strengthening program require a doctor and a physical therapist, please treat significant or persistent knee pain as your reason to see them, who can diagnose, treat and guide you, rather than as a substitute for that care.